Welcome to this series about the Australian Charter of Healthcare Rights, entitled Patient Power, Healthcare Rights and Positive Change. My name's Julie McCrossin and I'm a throat cancer survivor and a patient and family advocate. And this series is hosted by Health Consumers New South Wales and supported by the Australian Commission on Safety and Quality in Healthcare. The Australian Charter of Healthcare Rights basically spells out our rights in relation to access, safety, respect, partnership, information, privacy, and giving feedback to improve healthcare. And this series is all about encouraging you to learn more about this charter and to use it to improve your own and your family's encounter with health services, but also to improve health services for the broader community. This episode is all about giving feedback to improve healthcare, and it's my pleasure to welcome four guests. Welcome to Graeme Slade, the Acting Program Manager, Patient and Family Experience, Sydney Local Health District. To Nat Rataj, a social worker with New South Wales Health, based on the Central Coast of New South Wales, and the proud mother of a trans son, Kai. And Kai, welcome to you as well. And I know you're a uni student studying psychology. And welcome to Nadine El-Kabbout, a Muslim and Arabic community advocate and a youth advocate in southwest Sydney, a cancer survivor. And I know, Nadine, you're particularly passionate about culturally and spiritually appropriate services. I'd like to start with you, Nadine, because here's the little charter. And my understanding is that when you saw this, you're a cancer patient, you felt encouraged to speak up and write a letter about some of the things that were happening to you. Can you tell us about that?
Correct. When I was diagnosed back in 2013 with non-Hodgkin's lymphoma, I experienced many obstacles and challenges during my treatments and stay in hospital. And this was during my time with my stem cell transplant, where dinner was being arrived and I was handed my dinner plate and I was so excited. It smelled fantastic. And then when I looked at it, it was actually a steak. And I asked, oh, wow, this is a steak. Is this halal? And then the person who had delivered it went to check and then came back, was like, oh, so sorry, this isn't halal. And I just had a breakdown because I was craving steak so much. And but there was...
And you actually burst into tears, didn't you?
I did, yeah. I was quite upset because by that point I was 1.5 years into my treatments and it was difficult to find halal options that corresponded with what the dietitian was telling me to eat. There was a disparity between what was being presented on my breakfast, lunch and dinner trays and what I was being advised by my medical health team. So that's actually when I wrote, without even realising at the time, my first advocacy letter, where I wrote to the food services manager, the general manager of my local hospital, and a few other people as well, where I just gave some feedback and, just wrote about just providing options that were culturally and spiritually appropriate for any minority groups or any groups that, had similar difficulties that I had.
Just before I ask you the result, and we should say, I've had cancer myself, and you often lose weight with cancer, so food is part of your treatment, so it was a really important issue. But how did you find out who to write your letters to? Because we're all about encouraging people to give feedback, and you were quite strategic, weren't you?
It's worth mentioning that I have privileges that most people probably don't have. I was born in this country, so I speak English fluently. I also have a good education and a professional background that really armed me with those skills in order to be able to do those research and go on the website and find out, who do I address these letters to? Who can I, where do complaints and feedback go to? So I guess it all started with Google researching really and looking at the hospital's website or the South District Liverpool South District, Western Sydney website, and went from there. And I just really did a bit of research, but I also recognized that not many people have those abilities or those resources, access to internet, speak English fluently, not knowing where to start and where to look. But I would highly always recommend to maybe ask why you're in hospital. I have some feedback that I'd like to make. Who can I do that with? And most of the times they will refer you to a patient liaison officer, and that patient liaison officer will also highlight other places that you can write and where you can go from there typically.
Now, Nadine, you're involved in a whole range now of community representative bodies, and you're very involved with clinical trials and so on. But just in a nutshell, because of our time limitations, tell us about Project Chef and some of the other initiatives that you feel you've been able to play a role with in terms of improving food and cultural sensitivity.
Yeah, so Project Chef came about once from that advocacy letter, actually, and that was maybe 3 years later. I was asked to join this project that co-designs for food, where we can integrate and see what needs to be included. So from there, I was asked to participate, to provide some feedback based on my experiences and what I had encountered and what were the obstacles and challenges. And from there, they piloted a project at, I believe, 2 hospitals at the time. And if that was successful, that was going to be replicated across New South Wales hospitals. And they also teamed up with Sydney Children's Hospital Network for the implementation of Kids Chef at the Children's Hospital in Westmead. So, consistently challenging the status quo, of what if and why not when you've gone through certain experiences is worthwhile. Because you get to be part of projects like this.
And we'll put information about Project Chef and the kids one on our the website with all the other information about this series. Again, just in a nutshell, tell us about the lack of spiritual support when you had to return, I think with some recurrence. There was a possibility of the need for palliative care, and you faced some challenges there. Could you just tell us about that spiritual issue?
Yeah, so I remember when one day a chaplain walked into my room at the hospital, and I just was like, "Who is this?" And then he had explained who he was. And at the time, no one told me that this person was coming. I wasn't even asked if I wanted a chaplain to come over. And if I had been asked, I would have preferred a female, because there were being certain issues that are being more open to speaking in relation to. A particularly young person at that time, I didn't really know anything about, dying and bereavement support options and all of those things. So, I would have appreciated that someone would have approached me at first and asked me those questions. That way they could have catered to my specific and special needs at that time. It would have helped immensely, and I wouldn't have felt so isolated and alone at the time.
And I think your spiritual advisor, that man, was quite embarrassed himself.
He was actually quite shocked when he walked in. He was surprised and didn't know that I was a female myself. And we were both shocked.
Just finally, in a nutshell, how did you feel when you got those positive responses around the nutrition to your feedback? How did it make you feel?
It was quite positive. I felt that I was making a difference, and that at least, if it could help one person during their journey, that would have been worth it to me. So, sometimes with this type of work, you don't always see the fruits of your labor. It's really long term. And to me, I'm in it for the long term. I don't look at the short term, but, anyone that it helps is, of course, it makes me happy.
And how happy are we that you're here and the palliative care was not needed. Thank you so much, Nadine. I'd now like to welcome Rataj and her son Kai to the audience to talk to us. Now, as I mentioned, you're a social worker with New South Wales Health and the proud mother of a trans son, Kai. And I should say that I think you both marched in the Sydney Gay and Lesbian Mardi Gras for World Pride in 2023 with the Parents for Trans Youth Equity group. Now, Kai, you wrote a letter when you were receiving some services from the Child and Adolescent Mental Health Service. I've read your letter, a very coherent, thorough, constructive, an informative letter. I just want to, really say what a great letter. In a nub of it, what were you trying to communicate about your experience?
Basically that I felt very uncomfortable with the treatment I was receiving from the services. I was alone in a room with two doctors for 40 minutes, and the entire time I was misgendered, which is being referred to with the wrong pronouns, which is very damaging for a child who is trans because it really feels disrespectful to the identity that, you've chosen to identify with. And they also tried to disregard all my diagnoses and convinced me it was simply autism, because that's quite often linked with transgender kids. And so even though I had multiple diagnoses from multiple professionals, they were just telling me it was unrealistic and unlikely and that it was all boiled down to autism.
Can I come to you, Nat? How did it make you feel? Because you were also involved in saying this is the gender my son wants. You see this as a safety issue, don't you?
It was a really frustrating scenario, primarily because I was stuck in the weight room while this was going on. So I wasn't aware until I was invited into the room. And when the penny dropped and I realised that for 40 minutes he's been putting up with this, but on his own, just how traumatising that would be. Because at least if I'd been there, I could have protected him or spoken up. I feel like the more it went on, the less he felt he had the power to do that. But even so, when I did come in and actually try and set things straight, it was an aged male practitioner, a cis white male, that just was very resistant to all of it. They continued to misgender even when I corrected them multiple times. So, yeah, that was where we felt something had to be said, especially when, we're very forgiving about it. If people do get it wrong, we're appreciative of the effort. But when there's zero effort being put in to get it right, some education needs to happen.
When I have spoken to you before, you did mention safety as a critical issue, which is obviously one of the things on the Australian Charter of Healthcare Rights, along with respect, Kai, which is the other thing you were talking about. Can you explain, for people who don't know the world of transitioning, why mental health is such an important issue?
It's just so closely linked to the journey. It's not an easy time to be trans in the community, and there was at the time a lot of negativity in media and politics and sports participation and things like that. So statistically, trans kids have much higher rates of mental health, self-harm and suicide attempts, and or successful suicide. So it was something where in other facets of society, he was already getting pushback and judgment and criticism and all sorts of things that are really hard on, at the time, he was a 15-year-old kid. But more so when we're seeking support for his mental health and support for his well-being. And even in that space, he's not being seen and not being validated for who he is and who he's telling the world he is. It felt very unsafe. It just felt like it was going to magnify his issues rather than heal them.
You mentioned that you thought training was needed for staff, so this sort of thing didn't happen. If I come back to you, Kai, as I understand, your letter got a pretty good response and you got linked up with someone called Erin Hine. So tell us about the response to your letter and what happened next.
Well, Erin was absolutely amazing. Just took action immediately and ended up creating a presentation based on my letter to then present to people pretty high up in health and, executives and directors and all those kind of people to help try and implement change in the health system. And also did things within child adolescent mental health services, such as, helping implement pronouns at the end of emails and pronouns on name tags, just little things that make big impacts.
Look, I have to confess to you, I've only just in the last few weeks finally put my pronouns, she, her. We can't trust everyone in the world knows what a pronoun is these days, but there you go. But she, her. Why does it matter? Why is it important? Help us understand.
Well, It just makes it a much more welcoming and safe environment for trans people and makes them feel less isolated or singled out, because if trans people are the only ones putting their pronouns in places, it would make it so obvious that they're trans and make it so easy to target them and make it so easy to have them singled out or be uncomfortable. Whereas when everyone does it, it just makes it a general thing where it doesn't matter whether you're trans or cis, it's just a thing that everyone does, and it makes it just safe for everyone.
And explain cis.
Cisgender is when you identify with the gender you were assigned at birth.
Hey, thank you. The training that Erin Hine helped to develop is called Sharing a Trans Young Person's Experience to Improve Our Services. I mean, it's really a golden story, this, isn't it? You couldn't have asked for a better reaction.
Yeah, Erin's been amazing. Really spearheaded a lot of the response and made Kai feel heard and validated, which was incredible. But they've also stayed in touch with Kai and been a really positive influence ongoing. Yeah, and also marched with us at Pride at Mardi Gras as well.
Wow. And just finally, you needed to change the name, Kai's gender, on the health system files. Just tell us about that. How did you do that and the challenges you faced?
I think we had officially changed his name on the birth certificate. We had a passport, and we had provided that information to health, assuming that the gender marker would change along with the name. But we found out later, after several presentations, that the name would be Malachi Rataj, but there would be a lot of confusion because the system still marked him as female. So Erin again jumped into action, got the right form that we needed, and made sure everything went to the right place. And within no time, all of that had been updated, which just again helps us with the streamlined care that he now receives.
And again, interesting though that the help specifically from Erin Hine was needed. That is so interesting. In life, isn't it, in the 21st century, is getting the right form.
Yeah.
But,
absolutely.
Look, I'm just so grateful to you, especially to you, Kai, for coming forward and sharing your story, because I think it really helps people to understand. So, look, thank you. And, well, it's my pleasure now to welcome someone who works with New South Wales Health, receiving feedback and doing something about it. And welcome again to Graeme Slade, Acting Program Manager, Patient and Family Experience with Sydney Local Health District. Now, Graeme, you've got a number of examples where you've received feedback from patients or family and made changes, but let's start with a current project where you're employing lived experience educators into paid positions to be involved in co-designing education for your staff, and you're even going to have a lived experience educational panel. Just in a nutshell, what's the purpose of this and what are you hoping to achieve?
To embed within our education programs the lived experience of our community that come from a variety of backgrounds, to underpin their experiences, to tell their story about their healthcare experiences, but also to underpin the standards, some of the standards that equate with that.
Okay, and that's just a reminder that this Australian Charter of Healthcare Rights is linked to the accreditation process for hospitals and other health services. So there is a standard connected to it. So what's the link between hearing the sort of stories we've just been hearing and enabling staff to keep empathic?
I think it's through the education process, but also making sure that we listen to patients and having our lived experience educators on our education programs, that will reinforce the importance of the consumer message.
And I think you're going to share this message. There'll be face-to-face forums, there'll be podcasts, videos. You know, you really invest some communication resources in this process.
Correct. We're starting the interviewing early next week for quite a number of lived experience educators. We've got quite a few that have applied, which is really great.
Fantastic. Well, look, let's come to a nitty-gritty example where you had, I think, a letter, or you'll let me know, but a patient had a blood transfusion. Something went wrong and they let you know. So what went wrong and then what happened next?
So the needle that transferred the blood transfusion to the patient wasn't correctly placed. So the blood had gone under the skin instead of the vein. So the patient had written in, the patient was obviously treated at the time, but she wished to raise that as an issue. She wrote in, we responded to her, but importantly, we worked with her around an education program to remind staff of the importance of monitoring and making sure that cannulas are positioned in the right spot, obviously, and to retrain staff where we needed to, and it all worked well.
So it's so interesting the way you're using real-life examples to do what is probably regular education and training that you do, but you're linking it always, because I've had a lot of cannulas as a cancer patient, and if it isn't put in correctly, your hand can swell up, can't it?
Correct, and we gave a copy of the program to the person that was involved, and the person was very happy with the feedback that we'd actually done and the improvements for staff.
I think you involved your risk management unit as well.
We did.
Look, another example is there's been a problems for women who had a certain pelvic mesh inserted for medical problems. We won't go into them now. But at Royal Prince Alfred Hospital, RPA, in Sydney Local Health District, you had an advocate come to you to talk about the need for a clinic, a special service. Tell us how you responded to that advocate.
That was a multidisciplinary clinic, or a request from the advocate for a multidisciplinary clinic, and this was taken up with a passion by our chief executive, and we worked with the advocate. So it wasn't a complaint as such. We worked with the advocate and set up a multidisciplinary clinic that was worked with staff, and it is running wonderfully well.
Right, because I think people all over Australia are responding to this pelvic mesh issue.
Correct.
But you were able to actively involve this advocate and other women affected in your clinic.
So
is leadership from the top immensely helpful for someone in your position?
It's vitally important because that's where we get our change, and that's a belief in our consumers that we need to work with our consumers to affect the change that we need to do in the system.
You've got another example because Kai is here and we've heard the story of the challenge of transitioning when I know you have so many health appointments, so your engagement with the health system is critical. But you've had an experience where a patient who was transitioning, and I think their general practitioner gave oral feedback, so it was verbal, it wasn't written, to say there were problems in the use of language with some patients who are transitioning, the very issue that Kai has raised. Tell us what happened in your health service when that happened.
So you're right, Julie. So this was an advocacy issue. So it was a GP that raised the issues with us. So we worked closely with the Gender Centre and worked closely with the GP plus another GP in the local district, and we set up some training programs and some education programs through our what we call our RPA Links programs. So, and that went across all our staff to improve the experience of our LGBTQI plus community.
And again, you had a speaker from the Gender Centre, so you're connecting with the community.
Correct.
Graeme, thank you for such great examples of responsiveness. I'd love to come back to you, Nadine, again, if I could, because I'm so aware that in southwest Sydney, where you're an advocate around culture and faith and youth, there are so many Muslim people for whom their spirituality is critical, and yet you'll have many people with varied levels of English language efficiency and confidence. So you're talking now directly to some clinicians who are listening to this, watching this. Well, what's your message to them about learning more about your spiritual and cultural needs?
My number one tip would be just ask the consumer. Most times they were going to tell you what they specifically need. It's not like this complicated guesswork type of stuff. It's just having a real, authentic, empathetic conversation with the consumer and the carer. A lot of the time we also, we forget that the carers are an important part of the consumer's journey. So with me, and I know with many others, that their family is very important. So also involving the people that they care about within those conversations is vital. And also When you provide information, just check, like with the health charter, if it's in another language and you know that, say, their carer or a family member speaks another language, even if they speak English, if the consumer speaks English, provide it in both. Provide it in English and, say, in Arabic.
Look, thank you. And I'd like to confirm that this Australian Charter of Healthcare Rights is available in many, many languages, and we'll have information about that on our website. Look, I just want to say thank you to all of you for your marvellous contribution to this conversation about the value of feedback. Thank you to our guests. Thank you to you for joining us. And for more information and resources about the Australian Charter of Healthcare Rights, go to the Health Consumers New South Wales website, www.hcnsw.org.au, where you can also see information about all our guests, the whole series, and links to really valuable resources. My name's Julie McCrossin. See you next time.